sometimes the proactive spend, which isn't as obvious at the beginning, can save you a lot of money later on in the system. And it's having to try to distill what that balance looks like and what is good spend here in the system that's actually going to help you create healthier environments for your employees. Welcome to the CFO Show. I'm your host, Melissa Howatson, CFO of Venna. Healthcare expenses have become a significant and unpredictable expense for businesses, with costs continuing to rise. This uncertainty, combined with inflation and challenging market conditions, has created a complex financial landscape for companies. In response, many CFOs are actively seeking innovative approaches to effectively manage both healthcare costs and employee benefit expenditures. Joining me is Anisha Sood, Chief Financial and Strategy Officer at First Choice Health. Anisha has over 20 years of experience across the healthcare industry. She joined First Choice Health in 2019 and oversees finance and strategy, leading the development of their growth strategy, key partnerships, and corporate development initiatives. Before that, Anisha was a partner at Echo Health Ventures, and she served as Vice President of Healthcare Investment Banking at Credit Suisse. Thank you for joining me, Anisha.
Absolutely. Thank you for having me.
Can you tell us a bit about your experience in the healthcare industry?
So I've actually been in healthcare my whole career. So prior to my current role at First Choice, I spent a number of years in the venture capital side, investing in early stage healthcare tech and healthcare services companies. So think telehealth before it was ubiquitous, women's health, data and analytics, ESRD, all these early stage Series A, Series B, Series C startup companies that were looking to make a difference and really disrupt the healthcare system. Prior to that, I spent a number of years in investment banking out in New York. My clients there were everything on the healthcare side, from life sciences to medical technologies to healthcare services. And I actually ended up starting my career on the healthcare consulting side, primarily with pharmaceutical companies and clinical research organizations.
So you have a lot of in-depth experience in healthcare, and it's great to hear because you've looked at it from different angles as well. It hasn't always been from just one seat. So really looking forward to the conversation today. Now, in your current role that you have, you are responsible for finance and strategy. Can you tell me a bit more about what your primary goals and mandate are for your organization?
So, First Choice Health is about a 40-year-old company. We were started out in the Pacific Northwest by a bunch of hospitals, health systems, and independent providers that were looking to create a network alternative to the large insurers. Over the last 40 years, First Choice has become an insurer, decided to drop its insurance license, retained its third party administrative services. So we administer health benefit plans. We added a clinical line of business called medical management, where we do utilization and case management. And we also added an EAP, which its primary goal is to get people access to behavioral health. Historically, First Choice has been done this very quietly in the Pacific Northwest. So I would say overall, our goal is actually to do it a little bit more um, front and center. So we actually see an opportunity to bring what we are doing, being very in touch with providers, but being able to offer cost effective solutions to employers, actually bringing providers and employers together in a more direct financial relationship. And our goal is to enable that more broadly across healthcare. So we're expanding our provider partnerships, allowing that sustainable delivery of healthcare benefits. We are increasing our impact, and we measure that in two ways: by membership as well as our geographic presence, which has expanded from the Pacific Northwest into the Midwest and into the Mid South. And finally, our goal is to reduce the administrative burden in healthcare benefits for not just employers, but for their members and for providers, creating a more seamless, integrated experience. So I'd say those are really our three goals: is expanding our partnerships, increasing our impact, and being really, really effective when it comes to the administration work that we do.
So it sounds like you saw a need that existed and that you're somewhat differentiated maybe from what else is available in the market. W- What is that, that primary differentiator from your point of view?
The way that healthcare benefits have worked over time has been very standard. Here is a big, broad PPO network that is available for you to go see a provider in. Here is your traditional deductible. Here's your traditional out of pocket. Here's sort of, it's all been very I would say, standardized. We see an opportunity to disrupt that by actually making it more and more nuanced and more tailored to particular employers. So, if you're in a certain geography, is there something you can do differently with a provider in that community? That's probably who your employees are actually going to see for care and put them together in a relationship where they can do a better job taking care of those members, and you in return can receive a discount from a administrative standpoint, do we have to be so burdensome around stopping people from accessing care? Most people aren't going to the doctor because they have nothing else to do on a Tuesday afternoon. People are going because they need something. So, how do you make that really simple and easy for them to use? And so, what we're trying to do is say there's a lot of additional burden that we've created. Much of it is sort of unnecessary, and much of it is putting an in between or intermediary between the true healthcare relationship, which is a provider of care and their patient. So, can we actually enable a more seamless relationship? And that's really how we differentiate ourselves. I believe being provider owned is really part of that DNA, and being able to offer that from a provider perspective and from an employer perspective, who is really at the end of the day the payer of care in the US based healthcare market.
And so you've had experience, you've been in banking, consulting. What made you want to jump into the finance strategy seat within an organization?
Yeah, it's a good question. People don't always go the direction that I've gone. So honestly, I sat on a number of boards when I was on the venture investing side. So whether it be for a telehealth company, for a technology platform, for a women's health company, and what I found myself really enjoying was how do you grow an organization? How do you create a difference? How do you partner with the institutions, the large companies that are already in market to make a difference and move the needle? And really, that aspect of growing a business, I found I was only really getting quarterly when I was going to the board meetings and I wasn't engaged on a day to day basis. And that's really where my interest in being on the operational side really grew. And so my focus after the venture investing side was really to find an operational role. So I joined First Choice about 5 years ago. And as you mentioned, I have oversight into strategy and finance here.
Let's start with talking about the current climate when it comes to healthcare. What have you seen as some of the biggest changes and trends in the past few years?
There's been a many. Um, First and foremost, I think most people see that just rising costs in healthcare across the board, whether it be for healthcare services, whether it be for your insurance premiums. You probably also hear a lot about consolidation, uh, horizontal integration. So, providers, hospitals, health systems acquiring or merging, whether it be in a similar geography or in entirely different geographies, trying to actually get scale. And then from the insurance standpoint, we see a lot more what I call sort of creation of the conglomerate, that vertical integration. So somebody may have been an insurer 5 years ago, but now they own a pharmacy benefit manager. Oh, and now they own a provider. Oh, now they own clinics in retail clinics. And so that sort of vertical integration and horizontal integration we see really, really increasing over the last few years in healthcare. From a cost standpoint, it impacts all of us. It's the Kaiser Family Foundation is estimating about healthcare premiums to go up about 7% this year, which is significant, well outpacing inflation, as it does many years in a row. And the consolidation portion and the mergers are also sort of reducing choice and competition in the market. And so you kind of have both those factors coming in and creating what is a sort of higher cost, more consolidated, and probably less optionality for employers that are trying to do something different in the market. And that's really happened post pandemic.
This creates an interesting dilemma for businesses because Not often are you giving out annual wage increases in this kind of ballpark of 7%. If you could increase your prices to customers, maybe some companies are doing that, but that's not always a given that you could just increase prices to offset this cost. I'd love to learn more about what are some of these underlying cost drivers that are resulting in this situation.
Yeah, so just by setting the stage a little bit, so first choice is exclusively for focus on the commercial market. So another way of saying that any of the government programs, whether it be anything run by CMS, Medicare, or Medicaid, is not an area we play in. So I'll answer that from the commercial market perspective.
Sure.
So if you look at the breakdown of where that spend is actually going, about 85% of spend from a commercial standpoint is really spent on hospital healthcare services as well as pharmacy. So you go in for a doctor's appointment, you have a surgery, you need to fill a prescription. That's really 85% of the cost. The other 15% of the costs are on the administrative side. So the administration of your health benefit plan, other admin that goes along with that, as well as any other sort of reinsurance or anything else you might buy to help supplement your plan. So when you think about the cost, and if you and your audience, who's mostly CFOs, are looking at that, it's like I really want to focus on that 85% because that's where when I make a difference, there's actually a lot of savings. So what's driving the cost in that 85%? Costs across the board nationally are increasing. A lot of it due related to supply chain issues during the pandemic, but those costs have not started to go down. We're seeing those play through. A lot of staff losses post the pandemic as well. We saw a lot of early retirements between doctors and nurses, just given a very, very high stress environment. And so that access getting more and more difficult, and providers having to make that up in either salaries or other costs that they're starting to absorb. Inflation clearly across the board. There was a time where it doesn't look like it did today. About a few years ago, where inflation was quite a bit higher than it is today. And then if you think about the commercial market, commercial plans typically tend to subsidize some of the care delivered under government programs, whether it be Medicare and Medicaid. So, as reimbursement reduces on the government side, some of that is filtered back into the commercial side. So, all of those drivers are increasing, particularly for the care that you receive from a medical provider, increasing those costs. From the pharmacy standpoint, there's a lot of things that are creating that driver. More expensive drugs that are on the market that are being taken more frequently. For example, things like GLP-1s, more expensive rare disease drugs that are coming out that can cost $2 million and $3 million. Some of the spread pricing that ends up happening in market where there isn't a lot of transparency, and folks taking more and more margin from what a retail pharmacy gets paid and what is actually being paid for the drug. So both sides of it, pharmacy is becoming a greater and greater portion of that, but we're seeing costs increase on both the medical side and on the pharmacy side.
There's a lot of things there that are happening to drive costs. What are some of the key levers then that could be pulled to try to help mitigate some cost?
Yeah, so from a medical standpoint, there's probably three things that you can start to do to mitigate that cost. And that is really where you go for care, how much care is being received, and is the care that you're receiving of high quality? So let me break each one of those down. So, the site of care, which providers are you using to go get your care? Where are you going for imaging? Where are you going for your surgeries? Are you going to standalone imaging centers? Are you receiving surgery in an outpatient setting? And making sure that you are using the lowest cost of care setting. Additionally, not all providers charge the same amount. The industry historically has been stuck on what is known as healthcare discounts, right? So if somebody charges X amount for a surgery, we get a 40% discount, 60% is left. Somebody else may only get a 30% discount and 70% is left. So I definitely want to go with the 40%. But not all the 40% is created the same. And the easiest example I can think of is on the retail side. You could buy a $1,000 t-shirt and get a 40% discount, or you could buy a $100 t-shirt and get a 30% discount, assuming that they're of equal quality. Wouldn't you rather have the one that you got the 30% discount on than the 40% discount on? And so looking and seeing where the cost of care is actually more effective. Is it less expensive to go to this hospital for this sort of service versus going to this hospital for this sort of service. And being able to manage where that side of care and where folks are going can really be a big driver. Transparency rules as well have made this much easier to evaluate. So utilization care is really how much is being used and what does is unnecessary. So honestly, nobody overutilizes care. As I mentioned earlier, nobody goes into the doctor because, we're not doing anything else today. Why don't I go in and see somebody? People go in because they have a concern, they have a pain, they have an issue, something's uncomfortable, something needs to be addressed. And so as a society, we're not our utilization in terms of our initial seeking of care isn't really going up. It's really once we get into the system that we end up as a country doing more and more checks and diagnostics and things like that. And so when you come into the system, is the system able to handle as much as it possibly can under a primary care setting versus sending you off to a specialist? Or before something requires the need for somebody more expensive like a specialist, can you actually handle that? Think of conditions like chronic kidney disease before it becomes end stage renal disease. Is there an ability to actually do proactive management before it gets downstream? Similar with hypertension or diabetes. The implications long term of those chronic conditions are significant and have significantly more costs than managing that up front. And so, working with providers, working with even your administrator to figure out how to manage those chronic conditions and try to manage it in a setting that's lower cost is pretty key, and it can be another way you drive down costs. And the last one would say would be quality of care. So when you go to the provider, can they actually address what you need to address the first time? Call it sort of first call resolution, if you will, first appointment resolution. Maybe that's a better way to say it. And there's a lot of financial models out there, like risk arrangements and capitation models and other incentives that are really focused on getting healthy employees back to work, which is usually what employers are looking for. So that was a long answer to your question, but each one of those is so nuanced in terms of how you can actually drive improvement in the site of care, how you can drive improvement of the utilization, and looking for methodologies to align quality of care. But they all can have a significant impact on that 85% of care that we are receiving.
Well, and on the second one that you mentioned, utilization, I would say one of the things I've learned along the way, but it took me, I think, a little while to get there when I first started my career, was I used to think of this cost as, okay, well, what's it being spent on and how could you just make that go away or be reduced? But then I've realized sometimes the proactive spend, which isn't as obvious at the beginning, can save you a lot of money later on in the system. And it's having to try to distill what that balance looks like and what is good spend here in the system that's actually going to help you overall, one, create healthier environments for your employees, and also in the same time having the benefit of helping to keep these costs down because you're not dealing with all the reactive stuff. How should finance and HR teams be thinking about that? And how much would you encourage them to push more into the proactive side of healthcare?
Yeah, that's absolutely true. And I would say one of the biggest example of that is on mental and behavioral health. Mental and behavioral health tends to be a comorbidity for some of those chronic conditions, whether it be diabetes, hypertension, chronic kidney disease, any sort of condition. When you are not feeling well physically, there tends to be those things tend to go hand in hand. And historically we've probably underspent in that area and we need more access to mental and behavioral health, but addressing that up front can actually reduce the occurrence of those chronic conditions as becoming more and more significant over time. It's also true for primary care. If you go see your primary care physician and you get your regular blood work and you get any concerns you have addressed up front, the the cost of that downstream is actually quite a bit lower, but you're exactly right. All of a sudden you've taken something that has been underutilized up front and increase that. So it seems like your costs are going up, but you are absolutely saving costs downstream. I think I'd start with because we do a lot of employer based benefits. Is not everybody's created equal. The right set of benefits for somebody who runs a trucking company or is managing, the HR and benefits for a trucking company, that need for those employees will look very, very different than a manufacturing firm. You may have more need for virtual care if you have folks that are traveling across the country and driving. You might have more need for, a broader based access network, more rural access and utilization. Whereas if you have a manufacturing firm, and people are coming on site, you might have more need for um, musculoskeletal care, so back pain or other joint pain. And so, starting with who is the population that I'm trying to serve, and where are the particular areas where I think I can make an influence or is necessary for my population, starting there and looking at that, each one as being sort of unique and different, is definitely a good starting place. So you can start to design the benefit then to meet that need versus taking kind of what is a more peanut butter type of approach to selection.
You do raise a good point because it has to be relative to your workforce. I even think about, you know, in office versus hybrid. And when that came along, some of the things around even ergonomics and how we are doing our work, a lot more sitting in the day that can happen compared to even before when you might have been getting up and walking around, especially in the early days of COVID. It felt like we were sitting all day long in the same spot. Fortunately, that's changed a little bit, but good to be considering. Now, how would you suggest that CFOs stay up to speed on what might be changing in this landscape, especially with legislation?
And there's a lot that changed. We go back to the pandemic, and there was probably a change coming out on a daily basis. At this point in time, thank goodness it's slowed down, but there is a lot of changes. Most recently, trying to get a transparency around healthcare costs has been a huge initiative. There has been other initiatives on mental health and mental health parity and ensuring that there is access to mental health. But I would say that that is really our responsibility as a health benefit provider, and as a CFO, I would rely very heavily on my healthcare benefits broker to provide me that level of insight because it is getting more complex and changing so frequently. So I would say the answer to your question would be you shouldn't have to. You're already busy, managing all the finances of the organization. But there are experts around that can help you understand when legislation comes down, if there is a regulation on advanced EOBs and that's coming, what does that mean? And do you or need to have any part in addressing it, or really can you rely on your health benefit plan to address it for you?
Well, and it's interesting as you're saying that because when I think about really, it's not dissimilar to other types of advisors, be it tax advisors, health providers. It raises my confidence level that I'm dealing with the right broker when they are flagging to me, hey, this is what's coming. This is what it means. And they've sort of taken what can otherwise feel like a lot and a very confusing landscape to try to keep up on and say, listen, I'm reading all the signals. I know what's happening here. Based on what I know of your business, these are the two or three things that are going to impact you and you should be aware of so that they are raising our knowledge and understanding, because I always like to know what's happening and what the drivers are, but not making it so that we've got to like follow along all of the details that they're following. And to me, that's a hallmark of a good advisor when they're able to do that.
Agreed. A great consultant can break it down and make it very, very simple, very straightforward, and focus the attention on where it needs to be focused. Absolutely. Well said.
When I think then about running a global company for CFOs, because these landscapes can differ and often we don't even realize necessarily how it's changing. How would you suggest CFOs go about that when they're thinking about their healthcare and their employee benefits?
That's a great question. And I would say that every country is so unique on how they do healthcare benefits. It's having kind of an in country strategy for every single one. We have found that, at least, we're sitting in the US, and what we are doing in the US in terms of how we're administering the benefit, how people go for care, what the costs can be, how it's managed is entirely different from any other country. It's just not that transferable, unfortunately. We have a lot more healthcare related cost bankruptcies, individual bankruptcy in the United States. The costs in general are quite a bit higher, but access also looks quite different than it might in other countries. And so I'd say having somebody in country that can help CFOs guide them through this is what it looks like here. This is where you may need a supplemental benefit. In some countries, there you have a private system and a public system, and so what does that mean for for those employees that reside there? Each one is so different and hard to transfer. I would say some of the knowledge from one into another.
I do think, we do need to rely on advisors to help us. It is common when you're running a global business that you want to create a balance of things and you have a new idea, it's a new benefit. Well, let's give it to everybody because you want to be fair and you want to treat everybody equally. But what I found from that approach, if you're not careful in applying it, is there's one time where I remember we were saying, well, everyone gets benefits. So there's a benefit plan. We're going to have this in this country. And we were getting a little bit of pushback, but I think we didn't listen enough. And it wasn't until a few years later we came to realize that, in that country, because it was largely covered by government and people were not used to having the benefits like we were offering because they didn't have the same value. And in fact, the taxation on them was very punitive. We were forcing a benefit upon that population of employees that wasn't really even being valued because we were trying to do something different than what was a norm in their country. And in fact, there's other kinds of benefits or even compensation that would have hit the mark better. And so we were almost giving ourselves a disadvantage in trying to apply too much consistency and not appreciating more the nuance of like what really matters for these employees and this population. It would be like trying to give everybody the same statutory holidays, which is never going to work, right? You have to lean into what's different in that country. So a lesson learned a little too late, but was learned eventually. And we ended up rewinding, which is also not great because when you're now removing something because you're trying to correct it, it takes a lot of explaining to get through.
I would say that that actually applies even within the US in some areas. So if you live in a rural area versus living in an urban area and you have employees in both types of settings, they may be experiencing healthcare differently as well. And I think just spending a moment to recognize that one city may have great access because it has access to a lot of nurses and providers. But if you're in a rural setting where you have a regional provider, a regional hospital that's closing because it can't keep its doors open, that employee's access to care is going to look very, very different than others. And so it's not necessarily a one size fits all, even within the US, and actually looking at your employee base differently and looking at the remote workers and where they are. You may sometimes want to take that double click and say maybe they need access to something a little bit different than those that may be, closer to the home office.
What practical advice would you give to CFOs who are looking to either implement for the first time or enhance wellness programs?
So, from a wellness program standpoint, my biggest advice would be to integrate it into your health benefits. So, when I was on the venture investing side, there was a lot of wellness programs or wellness companies that were starting up. So, think gamification or step tracking. And the idea was the more you do for preventative health, the benefits would be longer term and would, in theory, impact sort of what the spend was on the healthcare side. The challenge for all of these, whether it be a wellness program that's sort of generic or a wellness program that might be related to weight loss or diabetes prevention or just getting more exercise, is engagement. And that's the issue that every single one of those companies has. How do I get somebody to actually engage with my app, with my service on a regular basis and retain that engagement over time? And so the easiest thing that we have found to maintain that engagement is really integrating it into your healthcare benefits. So you could put it in the network. So it looks like a benefit that it should be part of, you could go to the doctor for a primary care visit, or you could have, this sort of program that's available, but it's all integrated using the same amount of dollars or they're talking and they're talking to each other. That way you're also marketing and promoting and creating those financial incentives in collaboration with your health or benefit plan. And that really starts to allow people to use it and make it feel like it's part of your wellness benefit versus the expectations that I think a lot of the startups at the time had, where I know somebody will go into a different app. They'll remember to do this, when they're working out at the gym. They'll remember to do this the next time, they're traveling to figure out what's the healthiest thing to eat in an airport, and getting that dietitian support, trying to make it as seamless as possible and integrate it all together is pretty critical.
And that's making me think about flexibility, because we hear about
Mhm.
that sometimes. How important is flexibility in designing plans today?
Flexibility is really critical. And the idea kind of goes back to the fact that not all employers are created equal. So we talked a little bit of, a trucking company might be different than a manufacturing firm. That may be very different than a school district. I'll give you an example of high cost or high risk pregnancies. You're probably going to have a lot more high risk pregnancies happen in a employer where you have women of childbearing age, which maybe look more like a school district versus looking at a trucking company. And so as you think about designing those benefits, you may want a program, you may want centers of excellence, you may want to talk to your local provider about ensuring that that set of employees have access to really great prenatal care and maybe have extra visits to come in so a pregnancy does not turn into a high cost pregnancy or is managed up front. Whereas that benefit may not have any relevance to a different firm where it might be a different average age of that population, different gender mix. And so being able to flexibly say, you know what, I'm really going to pay for a lot of this because it's really important for me to make sure my employees are well taken care of. And I don't want to go downstream and pay for what could turn into, premature babies, for example, which are very, very expensive. And I want to pay extra to make sure that, that risk is minimized in one area. You need a flexible plan to say, I want to be able to do that for this population, but I need, but it may not apply to another employer. And so that flexible design, whether it be on a benefit side, working with particular providers in market, thinking about what you're paying for. Oh, I want to be able to have a benefit that's $0 out of pocket for a mental health benefit because I see in my population that really will help drive some of my chronic care savings. You should be able to do that. And that really will drive down cost savings, but you need a flexible partner to be able to do that with.
And do you have any tips for how to make sure that your benefits philosophy stays aligned with what your employees need as well as your organizational strategy?
I think it's a collaboration between both the HR side of the house as well as the finance side of the house. And typically, if your health benefit plan is working well, both are seeing the benefit. I would say most CFOs probably have a perspective that you want to pay for probably have the lowest expense, but also get the greatest outcome. From an HR perspective, you want employees back to work, you want healthy employees, you want productive employees. And I think you can have that all, but you really need to see what metrics you're going to look at for that. So, are you looking at, you mentioned before, you're looking at just discounts? That's probably not the right thing to look at. You may want to look at total cost, and total cost may be what is a total care being received? What is a total care potentially being avoided? What is the uh, return to work and how fast are employees when they actually are receiving care? How are you measuring sort of that quality? So maybe coming up with some of those metrics to say, I'm okay paying a little bit more for primary care visits, and that number might go up as opposed to just saying, oh, that's a higher cost, but that's the right kind of cost. And so setting those metrics between finance and HR to say, this metric can increase, but I don't want this metric to be able to go up. Or if this metric is going up, let's make a shift in our benefit plan to drive that down. And so being able to pull those levers, but you have to be looking at a similar dashboard or similar metrics to really determine which changes you want to be able to make.
What is your advice on some of the areas where HR and finance could find some alignment on some of the key metrics?
So HR and finance typically tend to work very closely together, but may have different perspectives. And so a CFO, for example, may say, okay, I want the health benefit cost to be as low as possible because that's an expense that's definitely driving up that line item. Where from an HR standpoint, their values may be more associated to ensuring folks get back to work and employees are productive when they are at work. They're not spending excess time away from work and they're overall healthy and able to be productive. And so the question is, how do you balance those two together? And what I think about for both of them is a concept of what's called total cost. So total cost is yes, it's all the things that are happening in the medical care that we are asking for, the prescriptions that are getting filled, the administrative costs. But it's also, are those the right costs to be spending time on? And so coming up with a set of metrics between finance and HR that says this is what we should be looking at from a dashboard standpoint, and it may not be dollar for dollar. And I'll give you a few examples. Primary care visits. We know that when folks go see their primary care physicians and you are getting your blood work done and you are talking about what may be concerning from a health standpoint and you're getting your regular screenings, that has a benefit downstream into either a chronic condition or something that we haven't caught before getting worse. So that may increase your cost up front. Clearly, if more people and we're encouraging people to actually get their primary care visit, but that total cost equation is actually going to go down over time, particularly if that employee is going to be with your organization over time. Another thing to look at is engagement. We think of looking at the costs for somebody comes in, they may have a high cost condition, maybe a high cost behavioral health condition where they're seeking services. The typical or traditional way to look at it is like, oh, did I get the best discount I could possibly get to? But what you might want to be looking for when area, there's maybe a high chance that somebody may need multiple hospitalizations relates to behavioral health, then you may want to start to look earlier and say, I have programs in place for this. I have management. I have case management. Are folks engaged with that program? And so you're looking at engagement as being that leading indicator to say my downstream costs are actually lower than what they could have been because my employee is engaged in these types of programs, and making sure that there is alignment between finance and HR on all of these different metrics, then you know that you are looking at an optimized health benefit plan and how that's performing versus just trying to see that did my bottom line go up or down from last year, because that might not be reflective in terms of the care that your employees are receiving, the health of your employees that are back to work, or the future costs that you might be incurring.
It's interesting. You're reminding me of some past experiences where, I think traditionally people think of, well, finance is going to just try to get it for the lowest cost, cheapest plan, give the minimum. And HR is going to ask you for everything they possibly can until they get a no, because why not? And yet what I have found along the way is the reality when you in finance lean into better understanding how this works and where it needs to go, and working so closely with that HR partner who's really close to the ground and hearing what is it that employees are asking for and value, that you get to better outcomes for both and for the business and the employee. There was, one time I remember years ago working at a company and HR kept asking for more coverage for vision care. And I was so caught up in but it's only an extra, I think it was like $100 every 2 years, really, and almost brushing it off as so insignificant, because from the costing side, as I'm looking at it going, well, that it wouldn't cost that much money. And yet there were these other bigger buckets that were being talked about. And I really appreciated my HR leader pulling me aside and saying, I hear you and I see the math, but understand perception wise for employees, being able to get those glasses or that nice next level pair, even though it's only $100, this isn't going to cost a lot. It actually is going a long way for employees. But it wasn't until they sort of were really beating me over the head with it to say, stop and let me tell you why this matters, that, it was one of those aha moments where I thought, just the math alone doesn't always get you there. And sure enough, we rolled out that benefit that year, and employees, the satisfaction the following year when we got our survey results back was way through the roof. And yet it didn't really cost us much at all to roll out a change like that. So I definitely think working together makes a lot of sense. Now, let's move over to what are some of the key areas that you think that CFOs should be focusing on to help their businesses with managing healthcare costs?
Just a one size fits all is not going to be the right approach. You're really not going to be able to find that savings. And so, if you look at what you're designing from a benefit standpoint, is kind of going back to those three core principles of where you get your care, what type of care is being utilized, and making sure that it's higher quality. And so designing a benefit structure that encourages the use of those preferred providers. Okay, it's less cost if you go here. It's less cost if you go to an imaging center versus if getting your x-ray in a hospital. It's less cost if you get your surgery in an outpatient setting. It is less costly to get this service actually at this provider than it is at this provider. So you can design what's called either a tiered benefit or some sort of encouragement to be able to do that. And then you have higher utilization going into that area. When you have higher utilization going into that area, you can then manage those patients because you know where they're going. You know that they've come in for a certain service, that they may need to go downstream to see somebody or a specialist. And so you can actually do what is called commonly population health. It is hard to do population health if you don't know where those employees are going to be receiving their care or when they're going to be coming in for care. But if you can start to do some of that management in collaboration with the provider, you can actually say, you know what, you came in for this primary care visit. This would be happening downstream. Oh, when you're looking for X service, you might want to go here, or let me help you manage this chronic condition up front. When you work in that collaboration, there's a lot more that you can do. Providers, in exchange for saying, yeah, we'd love to manage your population because that's actually the movement we are doing. It's what CMS is putting in place under all their different programs for quality. We want to apply that to a commercial population. In exchange, we may offer preferred rates, we may offer greater access, and that has automatic quantifiable savings for the employer. And then actually as a benefit downstream when you go buy reinsurance. It's like, oh, I'm already getting a better deal in market. So I think it goes back to determining what your employee base really, really needs, and then designing a benefit structure that encourages the right type of use of those benefits, but also makes sense for the type of employees you have.
As you're saying that, it's reminding me how critically important that benefit provider also becomes, because there are cases where because of privacy, we don't necessarily know what it is that the employee is dealing with or what the paths are. And so having that company in the middle that can help identify, recognize where those opportunities are and how could you maybe better construct your plan or encourage people to do a different path is so critically important, because we're not going to be hands-on managing this ourselves as employers. Do you have an example where you identified an opportunity to make a change to a plan for an employer that resulted in greater outcomes, be it bottom line or better experience for the employee without compromising the quality?
So, as a provider owned organization, a first choice administers benefits for a lot of hospitals and health systems. We had a case where we were brought in as an administrator. And typically, if you are a hospital health system, you would like your employees to receive care within your four walls. But you may not quite understand from a typical benefit structure or general communications that that benefit level is actually the best. So if you come into the four walls, you pay less money. You may have a co-payment instead of a co-insurance, and there is both financial benefit to you, and in exchange. In this particular case, we were working with a hospital and health system that actually had a population health group as well. So if you were coming in and getting your care in house, we could help close care gaps. We could help get you to specialists. And so when we first started, the employee base didn't quite understand that this tiered benefit structure was available to them. And there was such a great, both financial and, let's say, experience benefit at that top tier. So we were able to make that tiering more available and more understandable as part of our administrative platform. And because of that, that employer, which is uh, a hospital, increased the percentage of people that were coming in to their four walls. And these people are their own employees from when we first started to 2 years later by about 10%. So if you think about the financial savings, if you're the CFO of that hospital, you have all of a sudden you're no longer paying for that 10% of individuals. You're no longer paying a competitor to offer them service. You're actually doing it within your own wall. So you're really covering an additional a lot more internal costs. You're actually able to proactively engage with that population and actually say, we have other ways that we can help you take care of yourself and provide those level of services. And so we focus a lot on what we call this concept of domestic capture. How can you actually encourage that use of a top tier or a domestic benefit? Because it's a win-win, and it's a win-win for both the CFO in that case, most perfectly, with the HR director who is looking for that employee to get the care that they need.
If you could give just two pieces of advice to CFOs and CHROs who are looking to improve their wellness and benefit plans and manage their costs, what would that be?
The first one would be very simple, which is data, data, data. Getting access to your data. How is your plan being used? What are the costs in your plan? Typically, people are provided with high level information about the plan. Okay, this is on average how much cost is attributed to each employee. Oh, these are the trends in terms of overtime, but double clicking into the why. So maybe you see something where people are often being referred to a specialist for a different care, for a particular care pathway, and that specialist might be kind of expensive. Or it could be that you happen to have a lot of folks in your population that may be seeking care for diabetes, and that's maybe a program you want to put in, work with a provider, work with a care manager for, looking for that type of a pattern. High cost oncology or cancer care. Do you go after a centers of excellence type of approach to manage those costs and ensuring that people can get access to particularly very specialized care, for areas like cancer? So there's a whole bunch of questions that you can ask when you start to double click, but you can't start to do that until you have data and analytics and reporting that can really show you where those opportunities are. So the first thing I'd be doing would be asking for that level of transparency and the ability to go in there and have a consultative conversation, whether it be with your third party administrator, whether it be with your broker, whether that even be with a provider in your market who is seeing these patients day after day to say, what can we do to actually move the needle? The other one is just assuming that the status quo has to be the status quo. You don't have to take what's on the shelf. There is a bunch of different ways that folks are starting to align what they want and they find valuable for their employees with the benefit structure. And so things like direct contracting, value-based contracting, tiered benefit structures, direct primary care, where they're taking on a lot more responsibility for the lower acuity conditions you might have. There's a whole bunch of different methodologies and mechanisms out there that you can design into your benefit structure that allows you to actually start to manage care. I think just assuming that what is already on the shelf is the best for you as an employer, I wouldn't start there.
Anisha, thank you so much for joining me today. I've certainly learned a lot from you and your experience, and thank you for sharing that with our audience. Now, when we have a guest on the show, we do have two rapid fire questions that we like to ask. So, are you ready?
I am.
What to you is the hallmark of a mature finance organization in terms of how they operate?
So I've had this conversation most recently with our VP of finance, and I would say critical thinking. For our finances, I'm sure you know and your audience knows, we have a lot of policies and procedures, regulations, gap, and all these things that are important for us to ensure that we are doing all the right things and making sure that we pass our audits. But there is always that 20% that's a little bit different. As a mid-sized organization, we are always innovating and changing and adding new products. So being able to have enough policies and procedures in place such that you get the 80% of that done right, but that other 20%, your finance team can take a step back and say, hey, that's a little bit different. I may want to approach this a little bit different. I need to double click here. I need to be able to do this. I think that to me is actually saying we have a mature organization because we know the majority of what we need to do is standard, but the other stuff we're going to spend extra time on and think about a little bit differently.
Great advice there. The next question is, what is your go-to strategy to stay productive during the workday?
For me, it's just having variety in my day. I have the benefit of wearing two hats, as I mentioned, both from a strategy standpoint. So, whereas my day might involve positioning and presentations and new product design, it also gets to involve operating models and finance and board reporting. And so, being able to do one thing for a few hours and move on to the next. I felt like just that variety back and forth ensures that I stay productive because it's changing so often.
Thank you so much again for being on the show with me today. It's been a great conversation.
Thank you so much for having me.
If you enjoyed this episode and want to learn more, sign up for our free newsletter, where each week you'll get a roundup of exclusive resources designed to help you grow your leadership skills and drive strategic transformation across your business. Visit the CFOshowpodcast.com to sign up now. For the CFO Show, I'm Melissa Howatson. Until next time.